millions of dollars of medicine turning into trash at Gaza's main dump. This is aid donated by the international community. Local health officials say 70% of all the medical aid they've received since the end of last year's war with Israel is unusable, and now they are getting rid of it.
They are sending us a lot of items we don't really need. Sometimes they send us items we can't use at all or too much of it. At the same time, they are sending us medicine which is about to expire.
Officials say around 20% of all medicine sent to Gaza in the last 18 months had already expired or was about to expire. This figure is backed by the World Health Organization. Another issue is donated medical equipment. It's often up to 10 years old, outdated or broken, incompatible with the local electricity supply, or simply not what hospitals need. Some doctors say Gaza has become a dumping ground for unwanted medicine. One of the biggest problems is how to dispose of the medicine. Now, Gaza doesn't have the facilities to do it properly, so instead it's dumped out here, right next to the rest of Gaza's garbage. Rubbish workers unload these trucks with bare hands and little protection, adding to Gaza's mountain of garbage.
Gaza Strip is a small area, 360 square kilometers, in which there are no space for human beings. So what about the hazardous materials that should be disposed? These materials should be disposed in a proper way that cannot be leaked to the aquifer.
The health department won't name individual donors which have sent aid they believe is a waste. But 2 months ago, Gaza received $2 million worth of tamiflu drugs for the H1N1 virus from a country in the Gulf. This is after the threat of the virus had passed. Gaza's doctors say they didn't need these drugs, so they've ended up here as well. And officials say Asian donors often send huge quantities of poor quality, unsuitable drugs that have to be disposed of. But really, it's the patients who suffer. Gaza has a list of 115 drugs it urgently needs, like antibiotics and cancer drugs.
I'm calling on people all over the world to stand behind the sick people in Gaza. They're suffering from missing drugs because of the siege on the borders. We requested a lot of medicine more than a year ago.
Instead, doctors say the international community's refusal to deal with Hamas and coordinate aid means they are receiving the wrong types of drugs. No one doubts donors' good intentions, but this dump is a clear message to the world. Stop sending medicine that can't be used and give Gazans the aid they need. Nicole, Johnston, Al Jazeera, Gaza.